I don't know if we already started, but I'm going to restart my beginning if you don't mind. So sorry if I just repeated myself for those listening. But I want to introduce myself. My name is Patrick Cummings. I'm counsel for the New York State Association of Counties. On behalf of our president, Jack Marin, and our executive director, Stephen Aquario, I want to thank you for joining us this afternoon on a training for how higher education is safely providing this education service in a time of pandemic, in this time of a pandemic. Before we get started on this webinar, I want to thank our sponsor for this workshop, and want to remind everyone because of sponsor support, NYSAC's able to provide free access to our members for this and all webinars. So thank you to Let's Get Checked. Let's Get Checked was founded to help people get better access to health-related testing. They're a leading provider of diagnostics combined with telemedicine and e-prescribing. The company provides this solution since 2015 to help people get better access to life-altering information with ease. Let's Get Checked is uniquely qualified to help organizations meet the demand for high volume with high throughput testing of symptomatic and asymptomatic individuals. Now on to our workshop. I want to give a special thanks to all our speakers I'm about to introduce, and even give you a peek behind the NYSAC curtain on how this workshop developed. As many of our members and listeners know, this is NYSAC's last day in a full month of virtual training for our members on topics ranging from everything from police reform to COVID tracing. 2 weeks ago, the NYSAC staff did an internal review of how this conference was going, and there it was brought up, we are getting a lot of member questions on students returning back to college, community college, the colleges located in our counties. How is this being done? How are counties involved? Is this, what safety precautions are being taken? And from that meeting, we said, boy, we would have loved to have gotten this as a workshop. And this is information we want to try to get out immediately to our members. However, within that time frame, the 2-week time frame, we thought, would this even be possible? I mean, would this even be insulting to ask our qualified speakers in such a short time to prep? Well, we did ask, and not only did the following speakers say yes, they did so with enthusiasm and saying they've been ready to go with this training because they have for 7 months lived with solving this question of how do we provide higher education safely during a pandemic. So a special thank you to our speakers. We could not have asked for better, more qualified educators. And for you to do this in such a short turnaround time was truly an amazing effort on your part. We're going to have 3 speakers today. We are again very lucky to have. The first speaker is going to be Mary Beth LeBate. She's the president of the Commission on Independent Colleges and Universities, a non-for-profit organization that represents the chief executives at New York's 100+ independent, private, not-for-profit colleges and universities on issues of public policy. Ms. LeBate has more than 30 years of experience in government and public policy, including as the SUNY Senior Advisor to the Chancellor of Fiscal Policy, as well as for 23 years in the New York State Division of Budget as Budget Director and first Deputy Budget Director for Governor Andrew Cuomo. Our next speaker, we are honored to be joined by the President of Vassar College, Elizabeth Bradley. Prior to becoming the 11th President of Vassar College in 2017, she was the Director of the Brady Johnson Program in the Grand Strategy at Yale University. This is a university-wide program for undergraduates whose goal is to train emerging leaders. And last but not least, we are thrilled to be joined by the Herkimer County Community College President, Dr. Kathleen McColgan. Dr. McColgan joined in 2015 as the Institute's 4th president and currently serves as a member of the Higher Education Research and Development Institute, as well as the secretary for the New York Community College Association of Presidents. And again, so before we get started, and we'll kick this off to Mary Beth. I do want to remind all our listeners that if you want any questions, we'll turn at the end for about 10, 15 minutes for question and answer. Please type in, you'll see on a portal to your right, any questions. We'll field those and get back to you. And if we don't have time to finish all the questions, NISAC will make sure to get those answers and send them back to you in a timely fashion. So again, thank you once again. And Mary Beth, I turn it over to you.
Thank you very much, Patrick. And I want to thank, I certainly want to thank everyone on the call today. And I know you can't see me, and trust me, you're not missing much, so this is fine. I really want to thank our partners in the county. I know what an incredible effort you are all putting forward in very uncertain times, and just in terms of both dealing with higher education and helping us to come on track, but also just with the panoply of issues that COVID is presenting. You guys are the frontline folks, and we really appreciate all your efforts. I'm going to talk just for a few minutes on what higher ed has been doing. So I have a short presentation. I think, Kate, you're going to advance the slides for me, so I think we can go to the next slide. So just to give you a sense of what the private not-for-profit education is in New York. There are over 100 private not-for-profit colleges in New York. We have everyone from most of your counties will have a private not-for-profit college in its borders. Next. Next. So New York really has a very rich higher education ecosystem. We have about 185 private not-for-profit colleges across the state. There are 95 plus public campuses, SUNY and CUNY, community colleges and four-year colleges, and then we have proprietary colleges. Next, please. And just to give you a sense of how that all shakes out, there are about 1.2 million college students in New York. The private not-for-profit sector that we represent educates about 40% of them. And then you'll see SUNY and CUNY are our main partners, and we work very closely with them on many fronts. Next, please. And this again just gives you a snapshot of what you're dealing with in New York State. Where New York State students attend college, and you'll see that we really are. I think taxpayers benefit from, the economy benefits from the fact that we have such a rich sector in both public and private, and that's quite unusual. With most states have a few big public institutions and then a few some smaller private institutions. Ours is quite different than that. Next, please. So the topic at hand, the COVID challenges and what we've been doing to address them. There are, I think, I rank the COVID challenges into 5 buckets. We have financial challenges. We have public health challenges. There are challenges in interpreting the various guidance that's out there. There are certainly challenges and opportunities in our community relations. And then there's the pedagogical challenges of protecting and enriching the educational experience in these very unusual times. Next, please. So, reopening in a pandemic. As Patrick mentioned, we have been working on this for a very long time. And because of that, I think you're seeing some just extraordinary results. Back in May, CICU convened a panel of college presidents, and SUNY was at the table with us. We invited SUNY to the table to really come up with a comprehensive plan on how to reopen safely. We issued a report in May. I think Emily is here and can share. I don't know if Emily, you could put the link on the chat, but we could certainly share that with you. But it was a comprehensive report covering a whole array of issues that needed to be addressed to reopen safely. It was put in place, it was issued, our campuses reviewed it, and I think began to form their plans even before we issued it in May, but we think this report certainly helped to shape their plans. And it was done before the state gave out its guidance, so I think the state guidance was to some extent informed by our guidance. And one of the things that the plan very much focused on was the importance of testing, regular routine testing. We know that not every campus can do that, and we know it's particularly important for residential campuses, and where it is being done, and it's being done in many places, it is making a big difference. Next, please. So I think a few things to think about when it comes to the public health challenges that you all know because you live where we live. Colleges, I think, are unlike almost any other industry in reopening. We are really small cities. So we provide housing, we're restaurants, we're transportation, we're classrooms, theaters, gyms, offices, labs. All of the guidance that the governor has put out, while one industry might have to only look at one set of guidance, we were mindful of and had to adhere to a host of different guidance. And I think that makes our challenges somewhat unique. I think we've risen to those challenges, but we certainly knew going in that we were not a single source industry that was going to be confronted with one set of guidelines. We knew we were going to have to bring a assortment of guidelines together and implement them correctly. The other thing I think is a public health challenge is where the college population are residential campuses. We live, work, and eat together. It's a highly social. In normal times, our population, our clients are highly sociable. And we draw from around the world and around the country. Returning students to campus was a major logistical issue for us, and I think we did it right. The governor, as you know, imposed a 14-day quarantine on hotspot states. That began just as we were bringing our students back to campus. New York is the #1 state in the nation for students coming in from other states to go to our schools. So that is a real testament to our schools, but it's a real challenge when you think about now having to figure out ways of quarantining students from places like California and Florida that are really feeder states for us. And and no one really has done a more effective job at that than President Bradley Vassar, and that's one of the reasons I suggested that she be part of this webinar. So while we had a few hiccups coming into it because the guidance did come very late in our process, we carried it out, and kudos to the campuses, to the counties, and to the families who did what they needed to do to come back to New York in a safe way. Next, please. So what were some of the key actions that private colleges did? We provided each of our colleges put together detailed plans that really was a representation and outcome of months of collaboration across the sector. When people ask what are the positives that came out of COVID, can't think of many, but one that clearly is there and that I hope will live well beyond COVID is the degree of collaboration that happened between our schools and frankly with our schools and with public institutions. We have and we are trying to have open, transparent relationships with our local health departments and our counties. We know we are in this together. Long before the governor required, we now have our data on testing and on cases. We now have that available on a public dashboard, but long before that, many of our campuses had that data available on their own own websites in order to ensure the maximum amount of transparency. We really understand that the relationship between the counties and the colleges is a two-way street. We need you, and I would hope you agree that we add significantly to the economy in your regions, the cultural vibrancy of your region. So we've really tried our best, and we want to continue to build upon this as we learn more about the virus and about how to make ourselves safe. We want to build on those relationships with the counties. Next, please. So some of the key ingredients of our safety plans: robust testing. As we said in our May 15th report, we knew from the start that robust testing was going to be the key to bringing students back and bringing them back safely. Many of our schools required negative tests to return to campus. Many are conducting surveillance testing, either pool testing or individual PCR testing. And for those of you who aren't health folks, what surveillance testing simply means is instead of waiting to have to test a student or a faculty member or staff when they are symptomatic, we routinely test asymptomatic students. That's how we find out whether there is a prevalence quietly growing on our campus. And fortunately, what we're finding out is we are finding cases, and when we find those cases, thanks to your good efforts, we are able to trace and quarantine in time that we haven't had any major breakouts, and we hope to finish the semester that way. You're also hearing some about wastewater testing. We are doing that on our campuses. We are actually leading the research on wastewater testing. To date, the state has been very helpful in helping us identify potential sources of tests, but this has been, to some degree, our colleges really have been on their own to find the most reliable, most cost-effective testing that is out there. I think looking out over what, if I had one wish or when we enter for now and through the next semester, is that we can have an even closer partnership with state government in finding low-cost, reliable testing, and that state and federal government can recognize that this is a public health threat, and as a public health threat, resources from government to help support testing would be vitally important. Some of the other measures we've done: de-densification of our campuses. Many of our schools are involved in hybrid learning. So you're able to take your classes in person, you're able to take them remotely. You're able to live in your dorm, but still take it remotely. At times we require you to take them remotely. So campuses, dorms are not as full as they once were, and that's by design. Classes aren't as full as they once were, and that's by design. Our campuses, I think, have been incredibly vigilant and on-campus social distancing and face coverings. It's the new norm on campus. I think even though it's not required that you have face masks everywhere you are on campus, most of our campuses are requiring face coverings at all time and in the classroom. And then I think the other big change that we're making is very limited. We're encouraging and enforcing very limited travel from our students and visitors on campus. We usually pride being good neighbors and welcoming people to our campus. I think until COVID's gone, we are really discouraging and often prohibiting outsiders from coming onto our campus, and really discouraging students from leaving campus. We try to bring sometimes the community to them on campus so that we can continue to serve local economies, but we're really discouraging kind of widespread travel amongst our students. And what you'll see is that many of our schools have changed their calendar. So they started earlier in August and they will be ending in November with no breaks in between, so that you don't have travel, which then invites students to come back who may have been places and where they could have been infected. Next, please. So I think all of what we're seeing because of our efforts, we've had no major outbreaks on college campuses. Where we've taken swift action on tracing, quarantine, and isolation. And we've also been pretty tough on suspensions when students knowingly violate social distancing. We want to work closely with your communities to deal with the issues off campus. We work with local law enforcement. We have let students know that whether you're on campus or off campus, you're expected to abide by certain social behaviors. And if you don't, you can be equally penalized whether you're on campus or off campus. We have made, and I'm confident that we have sufficient quarantine and isolation space available, much of that on campus. When we haven't been able to accommodate it on campus, we've also made efforts to find facilities in the local community. One thing on contact tracing, we have done, many of our schools have trained contact tracers so that we can help supplement the work of the counties, because we know what a Herculean task it is for all of you to trace these cases. I'm hopeful that by our members being trained to do it, we can really supplement the work that you are doing. Next, please. So just a word about the state's recent directive to suspend in-person instruction. In September, the governor issued a directive that said if you have 100 cases or 5% of your total on-campus population, whichever is less, over a 14-day period, that you have to go remote for 2 weeks. This was not a parameter that was established in the higher ed guidance that was given to all of us back in June. 100 cases, so I talk about this only to say, if in one of your communities you reach 100 cases, I encourage you to look at who the college is and how much testing they are doing before you determine your level of concern. For a large college that is doing a significant amount of testing, 100 cases is minuscule. It's not, for up to this point, most of the state's metrics have been percentages, percentage of population, percentage of infected. Very rarely do you see a set number regardless of size. So we took some exception and had some debates with the administration over setting a clear 100% 100 case requirement that you go remote if you have 100 cases, because it's very different, say, if an NYU has 100 cases than it is if a Siena College has 100 cases, because the size of the populations are so different. So far, luckily, and I think thanks in large measure to our rigorous procedures that we've put in place, we don't have any schools that have approached 100. But when we do, if we do, it's something that you will hear about in your community, and I just urge you to look at the facts behind those 100 cases before anyone sets off a panic button. Next, please. The other thing that I think I want everyone to be mindful of, because we are major employers in your communities, and we want to continue to be major employers in your communities. Overall, we're about a private higher ed is about a $90 billion industry. We employ directly or indirectly 400,000 people. So this pandemic has been extremely expensive for us. A few months ago, we did a survey, so this number is probably on the low side, suggesting that our colleges have lost $1 billion in added cost or lost revenues because of COVID. This, of course, unfortunately spills over into the other investments that we can make in our community and we can make into our workforce. I think you've seen areas where we've been forced to do furloughs and layoffs, and they've been really painful for us, and I know they're painful for those in the community who have been impacted by it. Next slide, please. So as I said, we're about a $90 billion industry, 415,000 jobs. We want to come back. I think our communities want us back, but you want us back doing the right things, and that's what we are committed to doing. And we want to hear from you when you think we're not doing the right things, and I think we want to continue to have an open dialogue. We did see examples across the country where it wasn't done right. You know, UNC, Notre Dame, where I just dropped off my daughter. The day we dropped her off, a few days later, they put them on remote learning. So we see what works, we see what doesn't work, and I've just been really grateful that our colleges have done to date what's been needed to be done to do it right. Next slide, please. Or is that it for me? And that's it. Patrick, I didn't know if you wanted to take questions, or are we moving to all the presenters first?
We can take them all at the end if that's okay with you, Mary Beth. That was great, and thank you so much for that. That was a tremendous overview. So now we'll turn to President Bradley from Vassar to now talking about the overview, and now how did a college like Vassar, what are you facing, and how are you dealing with it directly in the field? So again, thank you, President Bradley, and we turn it over to you.
Thank you so much. I really appreciate that. I was muted, so I wish I knew sign language to tell everyone that. Patrick, thank you so much for convening this, and we're delighted to be part of the training this week, so really appreciate that. And Mary Beth, that was an incredible tour de force of what our experience have been. Our plan and whatnot. So really, we've been so lucky to work with you and CICU. I really appreciate it. And Dr. McColgan, I'm delighted to meet you and look forward to hearing from you. I do have to leave at 3 o'clock. I thought it was just an hour training. So I'll keep my remarks relatively brief and happy to take any questions when we have time for that. Like Mary Beth started out highlighting the importance of the government agencies and officials, particularly at the county level, I want to underscore and do the exact same. We know that public health is a global issue, but the regulations are at a county level. So of all the things the county government does, and they do a lot when there's a public health crisis, that's really where you depend on them. And I feel really lucky. Mark Molinaro, Ron Hicks, Jay Landolfi, Dr. Vadian have all been really tremendous partners with us. As Mary Beth said, since May or April or even March, when we started first saying, how are we going to bring students back? As Mary Beth described, Vassar is one of these private colleges. We have 2,500 students on in our enrollment. On campus right now, we have about 2,100 students, and 350 or 400 are remote. So it's about 85% came back and 15% decided to stay remote. Those who came back are studying in hybrid format. 3 different ways. One can be, you can go to the classroom with your faculty member and they may teach right there if it's a small class. We also have, I think, about 6 or 7 tents up. It's gorgeous on campus, and classes being given in tents. People are even zooming in tents. And then last, of course, you could take something fully remote. And our students, for instance, I teach a global health class because my background is public health, and you know, I have 16 students in the classroom and 3 on Zoom. And it's a pretty exciting global moment. One zooms in from Korea, one zooms in from Ukraine, and one from China. So it's a very international setting, and we're trying to figure out what time frame we really are on. As was described, our college does have enormous amount of students from all over. So we brought back about 900 students over a 2.5-week period from all those hotspot states. And that was quite a choreography. We do have Dean Alamo here, who's our dean of the college, and Wes Dixon, the special assistant to the president, and our entire team who really helped figure out meticulously every detail that would be both complying with the public health guidelines and also keeping our students sane. You know, you can't lock them in their room for 2 weeks and hope that they're actually going to stay there. So that beginning time was our really potentially very dangerous time. We did require the pre-arrival testing. We tested people on their 1st or 2nd day. We tested them again on their 7th or 8th day. So within 2 weeks, we pretty much had 3 negative tests on everybody. And that gave us quite a bit of confidence. However, during that time is the moment of influx when people are coming from these other states with COVID. And so during that 2.5 weeks, we probably had, I don't know, 11, 15 cases that were asymptomatic but tested positive. And again, were isolated, contact traced that day, contained the virus, really quarantine those students who were contacts and contained the virus. So the beginning time is always the most stressful. Our strategy has been called the island model, although we are ambivalent about that term, as island sounds a little bit like we don't think we need to be connected to anyone, and we know we are very connected to others, but the island is a metaphor for, we really, once we get our students here and we know they're negative, we're sort of managing for the fact, you know, they're not going to be perfect in their social distancing. For one, they live together, so you really need them not to be getting exposed. And so we have required our students to stay on this island and not go get a coffee in Arlington and not go down to Poughkeepsie or New York City, but really stay here. To enable that, we have contracted with our local businesses to come in and be vendors. And of course, we do a lot of diversity of vendors, but you know, we have Munchy Monday, Tasty Tuesday, all kinds of things where the places our students would have gone to can still, I think, benefit, and we are in community together. So that so far is working pretty well. In addition, we've asked our non-essential visitors to not come to the campus, and we have signs all over. And it was really hard for Vassar because we love having our town be part of us and kind of be integrated, but it just wasn't a public health recommendation at all. So, you know, people have been really good about staying off the campus, and if they must be here because they've got some essential, like they're a vendor, of course they go through all the variety of protocols we have in terms of masking, distancing, health assessments they fill out before they come to campus, etc. I think the hardest part was actually the poor parents who had to drop off their people, like drop and go, and they couldn't see their dorm, they couldn't visit, and we're just now, as we've been very successful, knock on wood, we're just now thinking about whether perhaps a few weeks from now we will let parents visit under a very controlled check in, check out, show us a negative test process. So we're considering that, taking a page from Governor Cuomo's good plan about opening 1, 2, 3, 4 in stages. We've also done that on campus, loosening every so often when we're having success. The other piece I wanted to highlight, besides the metaphor of being an island, is a question that we, I think, really learned a lot from, which is you can have a strategy like we're going to be an island and we're going to make everybody mask and we're not going to let anyone off campus. That's great. You know, you can write it on a piece of paper, which is very important. But how do you make it happen? The actual implementation. And we, based on the culture of Vassar and kind of the liberal arts education, we know darn well that our students think for themselves and they're very independent. They have an opinion. You know, you can't really regulate them. You can't really say, do this and expect them fully to do it. Instead, we tried to grow the implementation plan from the bottom up, meaning that we convened a group called Vassar Together, which has about 40 people, and then extensions in subgroups, ultimately probably including, you know, 80, 100 people in its design. And that group really designed how. The senior team said what, they designed how we were going to do it. And as a result, I think a lot of the implementation practices have been very inclusive, and they've been very careful not to profile. They've been very careful not to turn it into a police state, but really think of it more as, here we are together. How do we learn that critical capacity as a young adult to care for each other and to think that our destinies are really hooked together in what I do. We have sort of a saying here, we precedes me. And I think they caught it. One of the manifestations of this was something called the Community Care Team. And that is a group of peers, students, faculty, administrators, who are really like the restorative educational arm. If somebody sees something that doesn't look right, like a party of 35 people by the lake, you know, they call the community care team, or they put in a report to the community care team, and that team will sort of process that quickly, understand what's going on, make recommendations about who needs to be talked to. And, you know, we do have an escalation effort that, you know, it's first education, then restorative, and ultimately we can absolutely ban students from campus if they're not ready to live by our practices and our standards, although they can definitely stay in school because it's not so much disciplinary as it is a public health problem if they won't do everything that we really need done to stay healthy. And they, you know, they leave campus and study remotely. That's been a very rare occurrence, extremely rare. But the CCT has had a nice impact. I think it's hit enough people and the way people have been treated when they are approached that I think I hear a lot around campus, reminders and the reminded person saying, thanks for reminding me about my mask or whatever. So I do feel like that's been a nice add to this. I wanted to end my remarks just with what we've really learned for higher education more broadly, I think, at least as it pertains to residential liberal arts colleges. You know, we've learned a lot that the remote component kind of works, that in fact, if everybody's remote, it's not ideal, but we've really learned it can be done. And so I don't know whether we will possibly have another kind of remote curriculum. Who knows? And this would really be a faculty decision. But I think that the remote piece is not as scary as it was. I guess that's the bottom line. The second thing we've learned is that actually being together on campus develops enormous, I don't know what you call it, empathy and capacity just to watch our students. They are really joyful to be with each other now, and are the faculty, and they're not as picky now because they're just so glad to be here. And when we talk about potentially being remote for a few weeks during the winter, the first thing they say is, yeah, the remote education's fine, but I need to be here. I want to be here. It's not to party. It's to do important things, like we organized a socially distant RBG memorial. That was important. You know, people put up candles and kind of gathered around. or we had a lot of racial justice discussions after the decision relative to Breonna Taylor's murder. And there have been other things that have just emerged where people are starting to, I don't know, just develop the exact characteristics we sometimes don't see in our larger world right now. Being able to tolerate difference and talk about difference and mourn when things aren't right, and work together at things. So it's funny, as we're learning that the remote works, we're also just seeing in silhouette how important the actual empathic living together residential experience is. And then last, I'll just say, we've learned about efficiency. I mean, we used to have these bulky forms to register people on classes, no more of those. Now it's all online. Or, you know, how you evaluate your faculty, students evaluate, that used to be a big paper process. Now students will probably have to go online and do that. So there's just so many places. Our use of space, you know, could be more efficient. So there definitely are some efficiencies we will take and learn from, and probably never return to as many clunky processes as we had before. So for all of that, I am really grateful. I do think all these investments, as Mary Beth have said, have put a big strain on this industry, but I also think they're investments that will have payback in our future. So thank you very, very much.
Thank you, President Bradley. And you know, I know you have to leave relatively soon, so maybe we'll jump around. I know we got one question in, and love you or any of the speakers want to handle that. But I want to again thank you for your time and that presentation. And I want to let you know I've been speaking with Dutchess County in the public health in the past few days, and they've told me just how great it is to work with you and your school, and you really do have such a tremendous working relationship and open communication. So on behalf of that county, I want to thank you for the great work you're doing there. So the one question, and we'll get to our last week with the one question while we still have you, is dealing with you know, it's unfortunately just a matter of time before we'll get throughout schools some positives with the students, and if there's a need for quarantining in a dorm room setting. So you've got a dorm room. How does that? How are you going to try to handle that? Is this something where you take a student and put them, then isolate them at the separate part of the campus, or is it best to get housing off campus at that point and then just make sure that you're giving continual supplies and outreach to that individual that might need a quarantine? How is that going to work on college campuses when and if that unfortunate event happens?
Yeah, I'm happy to address it, and I can see Dr. McColgan nodding her head, so she knows how this works too. For us, we have got quarantine beds that have been identified that are part of the Vassar campus, where we, as I said, we have 2,500 students, only 2,000 or 2,100 are here, so that leaves us room. And these are annexes that are separate from the dorm, different entrance, et cetera, that can really be for quarantine. In addition, that would be for the close contacts when you're watching them to see if they're going to develop COVID. But for the person who tested positive, they need to be isolated. And we have a separate building that is used really for alumni, usually, who want to stay overnight. Instead, that's cleared out, and this is really used for isolation students. The last place we sometimes have used in the beginning is a hotel. Out on Route 9, 10, 15 minutes away, if there were students who showed up who needed temporary housing who did not have a negative pre-arrival test. We didn't want to let them just go into their room, so they went to the hotel until they could get a test. That's a little different. That's really not quarantine. It's like temporary housing until. But the quarantining is done in a whole set of beds that are on campus.
And I can speak for Herkimer Community College. We have 19 apartments. All of our residential complexes are apartment based. So there is exterior door right out into a parking lot. So we took 19 apartments offline that we are using for either precautionary / mandated quarantine, or if the need be, isolation. And our American Dining Creations, our food vendor, has been terrific. We did have a couple students that did need to use the mandatory quarantine apartments, and food service was delivered to them. So they really were isolated from the rest of the campus, and knock on wood, hopefully we will not have to use them during the remainder of the semester.
Perfect. And well, this was a great transition. Again, thank you, President Bradley, for that. And we really appreciate your time. And now we'll transition into President McColgan. And we thought this would be a perfect handoff, in that, as President Bradley was mentioning, the island, right, approach, and how they're a campus that has a lot of students coming in, and then from all across the country and across the world, and then they're there on campus, where now we're going to get a perspective of a community college setting, where we have dozens of community colleges with counties across the state, and these are more they've got campuses as well, but they also have the commuters coming in every day. And how do you handle that? So more of a, we'll say more of a peninsula, right, than an island. But with that, we turn it over to you. So thank you for being here.
Thank you, and thank you for the invitation. And it is my pleasure to meet you, all that are participating in today's webinar, and my colleagues, Mary Beth and President Bradley. I often refer to March 13th as a defining moment, not only in the history of higher education, but also right here on campus. And that was the day that I called an emergency meeting, all campus meeting, and informed not only our faculty and staff, but also our students that we would be moving to a remote learning environment for the remainder of the spring semester. And I think it was the very next day that the planning started for how we were going to not only transition hundreds of courses to what we refer to as real-time remote, but also how are we going to maintain the academic integrity, as well as business continuity, and maintain a safe campus community. So the planning started right away. And I believe I speak for the rest of my colleagues in the community college sector, if not all of the majority of SUNY. But we really started looking at all the guidance that was coming forth from the CDC, from the governor's office, from our local county health departments, as well as SUNY itself. And I just have to give Mary a shout out to Mary Beth. Because I have to hold this up. I hope she is still on, she can see it. I mean, this became yes, so thank you. So like many other colleges, and next slide, please, many other campuses, we quickly formed a task force that represented a vast array of groups across our campus. SUNY also had affinity groups for various positions across campus, so they were dialoguing. They would bring back to local campuses what we were doing as far as our planning. And I think it's safe to say that this general framework, this was a framework that Herkimer followed when we were finalizing our restart plan, is that everything had to revolve around the health and safety of our campus community. But at the same time, we needed to ensure our academic integrity, our business and continuity, our business continuity, as well as student engagement and community service, because we are a part of the larger community where our institutions are located. So when it came to academic continuity, this is where we really needed to hear from faculty. We are probably right now 80-20 remote as opposed to in-person, so on-campus in-person classes. And what faculty were asked is, what courses can we not offer in this virtual environment and maintain the student learning outcomes, or achieve the student learning outcomes? So that was the first charge to faculty, and they began their work in earnest. And it came out to be about an 80-20 split, where 80% of our classes now are offered real-time remote or in the virtual setting. And we do have some classes that are currently on campus in the face-to-face. But the other piece of it too was academic support. So we have, as all community campuses have, an academic support center, library, tutoring, etc., academic advisement. So how are we going to continue providing students with the academic support that they need? And there again, we going back to what President Bradley said, lessons learned, and I'm going to kind of thread this through as well. We learned that, boy, oh boy, we're resilient and resourceful and flexible and creative. And, you know, the technology that we needed to learn to advance what we are doing and to maintain the continuity and the integrity and the rigor has really, and I'm going to say pushed in a good direction. We decided to invest in Microsoft Teams, and that is the one platform that all faculty and the entire campus community is now using for meetings, for the classes, meeting with academic advisors, faculty office hours, as well as some tutoring. So some of our academic support is offered to students on campus in person, but the vast majority of it, again, I'd say probably that might be more of a 70-30 split, is offered virtually as well, where students can make appointments and meet face-to-face or in small groups with tutors, their advisors, etc. But that was one component that we really right from the start knew that we had to maintain the integrity. When we talk about business continuity and then getting back to the alignment with the health and safety of the entire campus community, we really did want to decrease population density across campus. We're probably at about a 50% reduction in the actual number of individuals who are physically employees, who are physically on campus at any given time. So how are we going to continue financial aid, our student accounts, all the other offices, human resources that make up the campus community? So we, again, invested in technology as well as smartphones, soft phones, where people could actually be at home and they click on their computer, and I'm just going to say I still believe it's a little bit of magic involved, but they are actually as though they were in their office. But there again, it was a shift, and it took some time and some resourcefulness on the part of our staff, which I could not be more proud of, with just all the changes that have occurred since March 13th. Student engagement, we knew that we could not just bring students back to campus. We are a residential campus. At the peak, we can house 630 students. We went to single bedroom configuration for the fall semester. So currently we have approximately 220 students who are living on campus. But we knew that we can't just bring students back to campus and say, okay, you know, stay in your bedroom, don't interact with any of your colleagues or your classmates. So really looking at how we can keep them engaged, be it safe, and most of it virtual, as although we are offering some in-person activities for the students as well. We did have students sign a HERC safe pledge because we knew going into the fall semester and bringing students back onto campus that we would have to address behavior modification. When students see each other, as we all do, we want to interact, and social distancing and wearing masks, it's not always fun. But we were very very explicit in what our expectations were going to be. And I have to say, and I echo my colleagues, what we're hearing from our students is that they are grateful. They are just grateful to be able to be back on campus, to be able to interact with each other, with faculty who are on campus, and with the other members of academic advisement and counselors. We do have personal counselors here on campus as well. They're grateful. So when we do have to remind them that no, your mask needs to cover your entire nose as well, they're apologetic and quickly respond. I am happy to say, you may have read it in the news, that Chancellor Malatras, our new SUNY Chancellor, has recently published, if you will, a SUNY uniform discipline protocol, so that each campus has the SUNY, the power of SUNY, if quoting a previous chancellor, regarding disciplinary sanctions, that if a student is found responsible for violating one of our codes or one of our expectations, we now have throughout SUNY a uniform disciplinary protocol. And the sanction can be anywhere from asking them to leave housing, although they still can continue their courses remotely, asking them not to, banning them from campus if they do not follow the expectations. And I'll get into our surveillance testing in just a minute. So it's nice to have not only our own expectations, and which have become part of our student code of conduct, but also to have the SUNY uniform disciplinary protocols as well. Campus community service. Part of our mission is to serve the communities that we are located in. And I just have to say, as I know that my colleagues have found, that the collaboration and the partnership and the support and advice that our local county health departments have provided for us and will continue as we move down this journey of the COVID-19 pandemic. But they have just been such a wonderful resource, and doesn't really matter what time of day that I call. If I have a question, they're there to assist along the way. That also being said, we have 4 individual employees who have gone through the Johns Hopkins contact tracing workshop training, if you will. So if the time comes, we will be able to supplement and assist our local county health departments with contact tracing for any either student or employee that happens to become positive in the future. But we also are aware too that the county and our community looks to the campus as a place, a venue for different activities. And so we are working as closely as we can with our local county to be able to continue to assist them. An example in Herkimer County is that we had the milk and food giveaway twice already, and we'll be doing it a 3rd time. And then early voting will also take place here on campus. So that's a little bit about community service. But last, I want to touch on what we're doing as far as our health screening and surveillance. So as I said, we have approximately 220 students living on campus, and very similar to President Bradley, students were required to quarantine before they returned to campus for move-in day. And upon returning to campus, we partnered with a local agency, healthcare agency, and all students had to be part of a rapid response test. We only allowed one family member to assist the student in move-in day, and that family member also had the rapid response test. They then had to wait in their vehicles for the 15 to 20 minutes. And once they were cleared, negative tests, they were allowed to move in. And if there were positives, and we did have 2 positive cases. One was a family member, one was a student. They were not allowed to continue moving in. So we started the semester, our residential students, we started with everyone being negative. Since that time, starting September 16th, we have partnered with SUNY Upstate Medical Center, and we are conducting surveillance testing for all of our commuter students. We have student cohorts, if you will. So our residential students are one cohort. We do have many athletic teams, and so we have students who live off campus. So our student athletes who are living off campus but are coming onto campus to practice with their teammates, they are another pool in our surveillance. Any commuter student who is coming to campus for an in-person class, they also are required to test. And we have offered voluntary for any faculty and or staff members. So the surveillance testing is whatever cohort you're in, you're assigned a day, and it's an every other week test. And to date, I'm very relieved and pleased to say that we have negative cases. So we will keep moving through the surveillance testing until the end of the semester. But similar to many of our campuses and sister institutions, we will be concluding all of our in-person and residential housing at Thanksgiving. There will be a limited number of classes that will continue after Thanksgiving on campus, but the vast majority, then it goes to like a 95%. Students will not come back after Thanksgiving break unless there is demonstrated housing insecurity, or we do have some international students as well. But the vast majority of our students will be home and will be continuing their coursework remotely until the end of the semester. It's not too early to start talking about the spring. I wish the outlook were a bit different, but at this point in time, we're talking about the majority of our classes for the springtime remaining in the remote or virtual environment.
Thank you so much, Dr. McColgan. That was great. Thank you all the speakers. Really appreciated this education. I've got a couple questions for you, if you and Mary Beth, if you still have a few minutes. And I know you touched upon this a bit already, but we got a question about the testing process itself. First, do you expect the testing process or the plan's been set for how you're doing it now as opposed to in the spring? Do you anticipate that there's going to be any changes to how that occurs? And then the second, really about how the testing is being performed already. Is this all being done, the test itself on campus with staff there assisting the students with that, and then obviously sending it out to labs, or is this something that you're having it done remotely through local medical facilities?
I can speak to that. We will continue for the spring move-in. We will use the exact same procedure that we used for the fall. For the fall, we have contracted with a local healthcare agency. They actually came on campus, and I think in the fall or in the spring, it's going to be a little bit different. In the fall, they had a great tent, a big tent in one of our parking lots. I don't think that's going to be realistic in the spring, but the healthcare providers were, the professionals actually conducted the test. It was with this nasal swab. And then they received, students and the family member received the results in 15 minutes. Once everyone was back on campus, the surveillance testing is actually the swab with the saliva. So it's that the student actually administers himself, if you will, but we have a testing site set up right here on campus where we have employees. There are 4 different stations where students register and employees They register, they have to scan a barcode, and then there's a test tube that has the swab for the swabbing the mucosa inside the cheek and under the tongue. And then there is an individual who is called the pooler, who we can batch 12 individual test tubes into one test tube. All of those samples go to a lab quadrant. I believe the lab's name is in Syracuse, partnership with SUNY Upstate. And we received the test results back within 24, 48 hours. So they're pooling 12 individuals at once. If that pool is negative, it's assumed that all of the individuals that made up that one pool are negative. If the pool itself comes back positive, then they go and they individually test each one of the tubes or samples, if you will, that made up that one pool. And then we receive the results, and then immediately contact tracing would start. So yes, we will continue that process in the spring, just like we are doing right now.
And Patrick, I would say that the only change that I could foresee is if the industry is able to perfect these rapid tests, saliva rapid test, point of care, where you bring a student on and can do an immediate saliva test and find out immediately whether they are positive. The market is racing to get a reliable test on the market, but right now they're not as sensitive or reliable as the more traditional PCR or pool testing, so we're not deploying them very frequently in our campuses.
Yeah, it's a really good point, Mary Beth, and good add. We're hearing more and more about these rapid tests and the need for them, but we haven't seen them roll out yet. But yeah, I think there's like more to come on that, right? And
Right.
When and if those are reliable, that's going to be the go-to. I know my son, my 9-year-old, unfortunately, he gets an upset stomach pretty easily, so he's had to have 2 tests now, and he is not looking for. He's been negative, luckily, but he's not looking forward to a third with the way it really is. I think we're all looking forward to the rapid test.
Right.
One more question for you, and I'll let you go. And again, thank you. Sports in general, and I know you touched on a little bit. How is this happening as far as are you choosing certain sports that might be a little less high risk? I know it's such a big part of college campus, and it's not to be dismissed. Is it something that you're seeing what type of sport, and then if you're going to allow that to happen on campuses, and or is it a delay of the fall to maybe the winter and spring? And if so, what are we hearing on that? Do you think there's any chance that any of these sports that aren't playing games right now might happen in the winter or spring?
Well, I'll start on that one, if you might. We are still waiting for guidance on college athletics from the governor's office. And I know they're working on it. I spoke to them as recently as yesterday on it. It wasn't as critical an issue for us in the fall because so many of the leagues that we participate in, so many of the conferences, had already made the determination that they would compete. So many of our schools are practicing now consistent with the guidance for recreational activities. We've had a few schools where the conferences are playing, like the ACC, where Syracuse University, who have worked very closely with the governor's office to establish all the necessary protocols. But I think going forward, it will really depend on what the virus looks like. And if we can keep the virus at bay, I know we are hopeful and we are practicing as if we will have perhaps some of the fall sports moving there, but certainly the sports that would normally come up in during these months, basketball, volleyball. We're hoping to be able to do that, but I think much will depend on the path of the virus.
We're part of the NJCAA, National Junior College Athletic Association, and they came out with their guidance late midsummer. So as Mary Beth just stated, there are no intercollegiate athletic competitions for the fall. Per NJCAA protocol, our teams have a certain number of practices that are allowed, as well as scrimmages. We have elected not to have our athletic team scrimmage with another college, so we are practicing. We do have scrimmages, intra team scrimmages that are taking place right now. We are streaming them because we are not allowing, unfortunately, we are not allowing visitors to come and attend the scrimmages. So a lot of practice going on, and we are hopeful that spring we will be able to host or attend some intercollegiate competition, but it all depends on what the virus is doing at that point in time.
Perfect. Well, that was great. And once again, thank you to all three of our speakers. Really couldn't have done this without you and your expertise. So, and as I mentioned before, on such short notice to give this much education was amazing. So thank you. And thank you to all our listeners for this workshop and Norfolk County members and all the workshops throughout this whole month. We really appreciate you being so flexible and helping us pull off a virtual fall conference, and hopefully going forward, much like our presentation talked to today, maybe we can have a hybrid or even better as the numbers get better in the future. So thank you once again to everybody that participated, and hope to talk soon.
Thank you.
Dr. McColgan, it's very nice meeting you.
Very nice meeting you, and thank you for your guidance as well. It was
well. Thank you for the partnership with SUNY. It's been really good.
Yes. Bye-bye now.
Take care.
Thanks, everyone.